Okay, so today I'm going to be going over inline suctioning, inline aerosols, inline MDIs, and cuff pressure monitoring. So I've kind of got a weird setup here. So I have my ET tube, my suction, my MDI adapter, and my inline aerosol adapter. And then, this all would be connected to a vent, but for right now I'm just going to have it all right here. So the first thing that I'm going to do is check my cuff pressure. I have these little disposable cuff pressure syringes. So I've got this here, and my little pilot balloon is inflated, which tells me that my cuff is inflated. So down here I can see that it's inflated. So I'm just going to connect this, and this little white float will either go down to the red part or the green part. So let me deflate my cuff, just so you can see. If I put this on here, it's not even registering because my cuff is deflated. So I can add air till that float goes to the green part. If I add too much, it'll go down to the red, and I can kind of back it off. So I'm right there in the green, which is telling me that I have good cuff pressure. So that's how you check the cuff pressure. And then the next thing that I'm going to do is an inline suctioning. So I've got my suction here. You would have this connected to your wall suction. The first thing that I'm going to do is they have this little button that you can lock, twist to lock. So I would unlock it, make sure I'm connected to the suction, making sure that it's on, and just test it a few times to make sure that it's suctioning. So the next thing that I do is I always hold the tube, so you make sure that when you're going in and out, you're not going to disconnect from your ventilator. So you just have to make sure you have a firm connection with your gloves on, and then you just slide it in, and you're going to tell your patient they're going to have a big cough, and then you suction on the way out, slowly, gently pull out so you get all of those secretions. And then this stays in this nice little bag, so it's always sterile. You don't have to worry about anything like that. The next thing is my inline MDI. So I have this little adapter here, and it comes with a little cover, so you're going to take that off. I have my medication. You pull it out, and then this top of this part here goes in this little hole, and then you push it down, and then you just push it down, and it will give it one puff, 2 puffs, however many puffs you need to give to your patient. Pull it out, and then you stick it back in to your container so you have your counter going and you can scan your medications and all of that. Cover this back up so it doesn't get dirty. And then the next thing I'm going to go over is my inline aerosol. So I have this little piece of equipment here that's called an Aerosol. I've got it plugged into the wall down here, and then I have my 2 adapters. I plug the gray part into here, and I'm just going to use some saline, and this little part opens up, and you put your medication in right there, and then you just hit power, and as you can see, it'll start coming through the line. So you always want to make sure I've got my pieces and parts kind of all mixed up, so it would obviously be going in line into my patient, but just to show you guys, it looks like it's coming out this end. And then you always want to make sure that you don't leave the room until your little Aerosol cup is completely empty, because then all of the medication has gone to the patient and it's not just sitting in the cup. And that's it.